things that can be advantageous to caregivers to make life just a little easier and a little more pleasant for the patient. And that's what we're going to go over today. And the technique that's most frequently used, and this has been around for many, many years. At one point I was a nurse and I used this in oncology for teaching cancer patients how to deal with their disease and figure out ways that they could still have some normalcy, problem-solving techniques. So it has come around, and now we're using it, and we know it really works for caregivers. It gives you some empowerment to think, okay, I do have to think outside of the box.
I know.
All right, so, oops, we went backwards here, sorry. So what is it? What is problem solving? It's a method by which we learn to understand the nature of the actual problems that we're having in life. We all use it every day. We just have simplified it in our brain on the how-tos. I mean, for instance, if you're having trouble getting someone in and out of the car, you figure out a better way to do it. You problem solve in your own mind. But when it comes to dealing with the physical anomalies that these poor people have, and then on top of it, the cognitive issues, you have to go beyond that. You have to be prepared ahead of time. So we want to make the problem, our reaction to the problem, to be different than what it might have been if we didn't do this brain stimulation ourselves ahead of time. In other words, probably if something changes and the patient doesn't do what we know is safe, we're going to react by getting angry. And we don't want to do that, because then we have those guilt feelings. Darn, I shouldn't have done that. I shouldn't have felt that way. So we want to be able to have our reaction become a more positive one for them. So why problem solve? Well, it's obvious that we need to find solutions to individual, unique situations. We're going to go around and have a few examples in here. You're all going to have lights go off in your head that this did impact you at some point, but it was probably just a little different scenario, but they all still have similar reactions. We know that there's constantly changing circumstances. We know that just with the ALS patients, how one morning they may be able to use their right arm and the next morning they may not be able to use their left arm. So add to that the changes that can be similar with the FTD component. So we're kind of trying to help write a manual for dealing with these problems, but it's not going to be a specific one to each individual. It's just an overall general philosophy of how to problem solve. You individually know your situation better than any of us. So when you come to clinic and you tell us things, we pick your brain to get more information because each person is so unique. And you have the most knowledge in which to deal with what you can do and what you can't do. You know, we can give you a lot of recommendations, but if you don't have the ability or the opportunities to do those things, you may be living far away from your loved one, or you may be right there but not have enough help on board, then it may be different for you. And we want to give you a tool to individualize the approaches that you need. So the problem-solving technique. You probably don't go through all of these individually every time you solve a problem. I hope not, because you might spend your day trying to solve a problem. But the formal problem-solving means to identify the problem, which so often after we work through the whole problem, you realize that what you thought was the problem isn't really the problem. We want to brainstorm options, because we know lots of times what you think is the best solution turns out to not work. You get frustrated, so you have to have backup strategies so that when the first one might not work, you have something to go back to so you don't have to go through this whole process again. We know that if you do this and you brainstorm options, that you need to be able to evaluate each option to see which one's the best, so you start with the best possible solution rather than the one that's going to have the least positive outcome. You want a positive outcome, you don't want a negative outcome. And so often what we think is the best turns out to be the worst. We want you to assess the outcome. Did what you came up with, did the brainstorming idea that you came up with really work? Or did it only partially work? And only you can do it if you assess the actual outcome. And if it doesn't work, what do? you try the next one on the list. And we're going to have some fun with it, coming up with some brainstorming, and you'll see. Effective solutions then achieve the problem-solving goal. In other words, at least for the moment, what you came up with worked as a solution. Again, we know that these change all the time. We want you to maximize the positive, just like Sue mentioned. You know, we want you to praise, not degrade an individual. So we want to maximize the positive outcomes with them, and definitely minimize the negative. With a child, I mean, a lot of studies have been done with children, and we know that punishing for everything doesn't work. Especially as these kids get older, they'll figure out a way to do what they want to do anyway. But if you figure out a positive way to help them, your chances of success are a lot greater. So to give you a couple examples, this was John Mackey, and he was an NFL player. You guys might know.
Yes, he is.
Okay, and the former tight end for Baltimore Colts. And his wife was having a terrible time with him because he really would not, he wasn't able to control his bowels any longer, and didn't know how to keep him active and still be able to get him out. So she finally, after all other things seemed to fail, went to his teammates, who were very involved in his care, and asked for help. And they came up with a plan that really, really was awesome. They decided that they were going to ask him to try Depends for them, to see if that would work, that they could get through a whole game with needing to have an escape to the bathroom. And he very eagerly decided to participate because he felt he was doing one for the team. And that solved the problem for him. He was very willing to wear them. And I take it that this is a true story. Thank you. This is one of our true stories. And a real life, what do you do with someone if they're having the behavioral entity and you take them out? And this was a very active couple who went out to dinner a lot with their friends. This was one of their favorite activities. And yet, when they took him out, he got rather fresh with some of the waitresses. And it got embarrassing to the caregiver as well as the friends that they were going out with. So they decided, well actually the wife decided to find a place that had a booth. You can see it on the far left over there. It goes around like in a semicircle. And what they did was they put him in the middle of that semicircle, and then they were around, and the wife would order and the waitress would serve, and he didn't have that opportunity. And it kind of took his mind away from what he was going to do, and it allowed them to go out to eat, which was really, I thought it was a pretty ingenious idea on her part. So what we're going to do today is we are going to pick a challenging problem at the moment. It doesn't, we will just pick one from the group and then maybe a second one, and then we're going to give you an opportunity to do it on your own. And we're going to go through the problem-solving technique in a simplified manner. We're not going to do the whole thing because you don't have the time. I want to make it as easy for you as possible. And then we're going to share the results within the group. But like I said, we're going to start out with working as a group, and then we will let you do one on your own. And we're going to try your best solutions then when you go home, when you do your own problem. Okay, tips for effective problem solving. Trust me, the first option won't always work. And it may work for a day or two, but then you're going to need to have backups anyway, and you don't want to solve the same problem over and over. What you originally thought was the problem many times ends up not being the real problem. And you'll find this out as we go along. Brainstorm all the options. You know, the term used to be think outside of the box. I don't know if that's still around or not, but that's truly what you have to do. You can't stay with the comfortable. You have to go outside of the box and be creative, because obviously if it was that simple and it was within that little box of the normal, it would have worked, and it obviously didn't. Seek options from other caregivers, family, friends, ALS staff. We do find that when you sit here in the group and we talk about one problem, it's amazing how other people can come up with other ideas that you never would have thought of because they're outside of the situation. I get phone calls quite often from caregivers that are having cognitive issues with their family members, and I'll just stay on the phone and help them brainstorm. Because I'm an outsider. I'm not there in the house, but I know what kind of options could be that maybe they weren't thinking about. So seek help. What worked today may not work tomorrow. And I think many of you in here can justify that. And there's always, 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 always another option, and it's called persistence. And I truly believe that. Sometimes we get so frustrated that we think it's completely hopeless, there's nothing else we can do. But that's where this thinking outside of the box truly defines itself. So, the take-home points before we start our actual work is you have control to change behaviors or to change the reactions to behaviors. And it's not always the patient's behavior that you've got to change, because you're really not going to change their behavior. It's your behavior and your reaction to their behavior that's got to change. Brainstorm, 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 because that's what gets you to the point where you realize that there's always another option. And try the solutions until you find the best one that works. And we are here for you. I'm a phone call away, super phone call away. And we've done this for a long time, and we have, I saved a lot of the examples over the years because I knew getting old, you don't remember all these things. So, you know, I'm sure there's been many others that are going through the same thing a little differently. Okay, so what I'm going to do is pass out, I want you to each take one of each of these sheets as they come around.